My article explores the possible options for Medicare coverage of lung cancer screening and explores which of these options would best ensure that the benefits of screening outweigh the harms in the Medicare population. In one of the biggest breakthroughs in the field of lung cancer in the past several years, annual low-dose CT screening has been shown to reduce lung cancer death for high-risk individuals, namely middle-aged or older smokers. However, CT screening for lung cancer also can cause harm. About a quarter of patients undergoing CT screening are found to have a pulmonary nodule or spot in the lung that requires further evaluation. The vast majority of those nodules do not turn out to be lung cancer, but the evaluation process exposes patients to potential harms, including anxiety, radiation exposure, and physical complications for those undergoing invasive testing or surgery. In light of these trade-offs, the Center for Medicare and Medicaid Services, or CMS, asked their advisory panel to weigh in on the evidence for and against lung cancer screening in the Medicare population. The advisory panel returned a vote of low confidence that the benefits of CT screening would outweigh the harms in the Medicare population, particularly in the community setting. The advisory panel's vote came as a shock to many in the medical and the lay communities. After all, CT screening for lung cancer has been recommended by several organizations at this point, including the U.S. Preventative Services Task Force. In fact, because of the USPSTF recommendation for lung cancer screening among high-risk individuals, private insurers are required to offer coverage for this service to eligible individuals beginning in 2015 under the mandate of the Affordable Care Act. My article explores what the possible options are for CMS moving forward for Medicare coverage of lung cancer screening. I'd like to tell you what I believe are the worst case and best case scenarios for CMS to pursue. The worst case scenario would be if CMS decides not to cover lung cancer screening for Medicare beneficiaries at all. This would create a double standard through which younger individuals and those who can afford to pay out of pocket would be able to receive lung cancer screening, while Medicare beneficiaries would be denied this service. This would surely exacerbate pre-existing age-based and socioeconomic disparities in lung cancer outcomes, a scenario that everyone wants to avoid. Therefore, CMS should not pursue this option. Meanwhile, I believe the best case scenario would be for CMS to cover lung cancer screening only when conducted in certified centers of excellence. Professional societies are already working together to develop quality standards for lung cancer screening and to define those elements that would be necessary to ensure that screening is conducted in a program that is comprehensive, safe, and effective. This certification process would ensure that the necessary precautions are in place to ensure that the benefits of screening outweigh the harms for Medicare beneficiaries. Therefore, this is the best option for CMS to pursue.